Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Psychiatric medications. A nurse provides instructions to a client taking fluoxetine, Prozac, a selective serotonin reuptake inhibitors, SSRI, antidepressant. The nurse tells the client to take the medication. Option A. Early in the morning. Option B. During lunchtime. Option C. At snack time. Option D. At bedtime. Right answer is Option A. Early in the morning. Fluoxetine is used to treat major depressive disorder, bulimia nervosa obsessive compulsive disorder, panic disorder, and premenstrual dysphoric disorder, PMDD. It is taken early in the morning to prevent interference with sleep. The risk of experiencing serotonin syndrome when SSRIs are given with monoamine oxidase inhibitors such as phenelzine, Nardil. Serotonin syndrome is best characterized in which of the following? Option A. Hypotension and urinary retention. Option B. Muscle rigidity and high fever. Option C. A productive cough and vomiting. Option D. Tea-colored urine and constipation. Right answer is Option B. Muscle rigidity and high fever. Serotonin syndrome symptoms include high body temperature, agitation, muscle rigidity, tremor, sweating, dilated pupils, and diarrhea. A client with depression who has been taking amitriptyline for 3 months returns to the clinic for a follow-up. The nurse observes the client in which of the following symptoms? Option A. Suicidal thoughts. Option B. Lack of energy. Option C. Loss of interest in personal appearance. Option D. Neglect of responsibilities. Right answer is Option A. Suicidal thoughts. Clients may have thoughts about suicide when taking an antidepressant such as amitriptyline, especially clients younger than 24 years old. Options B, C, and D are signs of depressions but are most likely improved as the treatment goes on. A client is prescribed with sertraline, Zoloft. To guarantee a safe administration of the medication, a nurse would administer the dose. Option A. As needed only for depressions. Option B. Early in the morning. Option C. Take on an empty stomach. Option D. At bedtime. Right answer is Option D. At bedtime. Sertraline, Zoloft, is an antidepressant. It may be administered in the morning or evening, but giving it in the evening is more favored since drowsiness is one of the side effects. A client arrives in the emergency room with a tricyclic antidepressant overdose. Which of the following measures should the nurse do, except? Option A. Maintain a patent airway. Option B. Administration of sodium bicarbonate. Option C. Gastric ravange with activated charcoal. Option D. Administration of an antipyretic. Right answer is Option D. Administration of an antipyretic. One of the signs and symptoms of a tricyclic antidepressant overdose is hypothermia, so an administration of an antipyretic will not help in the treatment. Option A. Maintain a patent airway by providing measures such as oxygen. Option B. Sodium bicarbonate resolves metabolic acidosis and cardiovascular complications. Option C. Gastric ravange with activated charcoal is done for GI decontamination. A newly admitted client has started taking bupropion, Wellbutrin. The nurse monitors in which of the following side effects that would indicate an overdosage of the medication. Option A. Headache. Option B. Dizziness. Option C. Constipation. Option D. Seizure. Right answer is Option D. Seizure. Wellbutrin, bupropion, is an antidepressant medication used to treat major depressive disorder and seasonal affective disorder. Overdose symptoms may include seizure, muscle stiffness, hallucinations, fast or uneven heartbeat, shallow breathing, or fainting. Options A, B, and C are the common side effects of the medication. A nurse is giving discharge instructions to a client who is prescribed with isocarboxazid, Marplan. The nurse will tell the client to anticipate which of the following side effects of this medication. Option A, weight loss. Option B, dry skin. Option C, dizziness. Option D, fever. Right answer is option C, dizziness. Isocarboxazid is a monoamine oxidase, MAO, inhibitor. Dizziness, drowsiness, tiredness, weakness, problem sleeping, constipation, and dry mouth may occur while taking it. Options A, B, and D are not side effects related to the medication. A client with depression is taking phenelzine, Nardil. The nurse advises the client to avoid consuming which foods while taking the medication. Option A, crackers. Option B, vegetable salad. Option C, oatmeal. Option D, yogurt. Right answer is option D, yogurt. Phenelzine, Nardil, is a monoamine oxidase, MAO, inhibitor. The client should avoid eating tyramine-rich foods such as chocolate, alcoholic beverages, aged cheese, yogurt, processed meats, and fruits such as raisins, avocados, bananas, or figs. Patients taking MAOIs have the tendency to experience hypertensive crisis, especially during an interaction with other drugs such as epinephrine. Which of the following is a sign of hypertensive crisis? Option A, orthostatic hypotension. Option B, diplopia. Option C, delay in ejaculation. Option D, hair loss. Right answer is option B, diplopia. Monoamine oxidase inhibitor toxicity symptoms include hypertension, tachycardia, diplopia, nausea, dilated pupils, palpitations, constricting chest pain, and altered mental status. Options A and C are a common side effect of monoamine oxidase inhibitor. Option D is not a related symptoms of hypertensive crisis. During a hypertensive crisis, the nurse makes sure which of this medicine is readily available. Option A, lithium citrate. Option B, diazepam. Option C, phentolamine. Option D, phenobarbital sodium. Right answer is option C, phentolamine. In a hypertensive emergency, the first goal is to bring down the blood pressure as quickly as possible with intravenous 4 blood pressure medications to prevent further organ damage. Phentolamine mesylate. Phentolamine mesylate is used as an antidote for a hypertensive crisis. Option A, lithium citrate is a mood stabilizer. Option B, diazepam is a benzodiazepines. Option D, phenobarbital sodium is a barbiturate and sedative hypnotics. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.